So, hello, I'm Matt Wright from St Thomas's Hospital, and I'm here at Boston for the annual Heart Rhythm Scientific Sessions meeting, which has been a very interesting and exciting meeting. Clearly the headline news has all been around Cabana and what this sort of negative or neutral trial means, and what is important. Is it intention to treat, or is it what treatment people actually received? There's been a lot of work now, mainly in the poster hall and the exhibition hall, but also some abstracts on contact force and looking at the sort of long-term outcomes. So I chaired a session where outcomes going up to 2 to 3 years were looked at. What was interesting here is that in the first year there didn't appear to be any difference in outcomes between those who'd been ablated with a contact force sensing catheter and those who hadn't. However, after a year, the curve started to diverge, and it appeared that people who'd had an ablation using a contact force catheter did much better than those without. It's certainly interesting, and they're going to look and try and figure out why that is the case. But I think what we've seen before in the literature is, whilst everyone accepts pretty much that contact force and knowing that you are actually touching the tissue is clearly a key determinant of creating a lesion or not, actually proving that in terms of outcomes has been a little bit more difficult, with a number of randomized trials not showing any difference. I think at this meeting, looking at different posters and abstract sessions, is that there is more evidence that there is a definite advantage to using contact force. It's often relatively difficult to measure, and the difference is often relatively small. But I think once lesion contiguity is taken into context, as well as just creating a lesion, the reasons for failure of an AF ablation are not purely due to the lack of lesion transmurality, which is one of the things that contact force can help with. So obviously lesion contiguity is also important, and this is perhaps why it has been difficult so far to prove that using contact force has really made an impact on outcomes. So as I said, there's been a number of posters here. A lot of sort of old work is being repeated using contact force, and as with any trial, you always seem to get better results with the newer technology. Whether this transmits itself in the long term is always up to debate. So an interesting meeting, as it always is. Been able to meet lots of colleagues, and the Cabana is the trial of the sessions. Okay, thank you.